Good evening, friends. I am Dr. Neera Bhan, and today I have made a video to help you understand the implications of bleeding or pain or both in early pregnancy. This is a frequent occurrence and often causes a lot of anxiety and distress to a whole lot of girls. Sometimes it may be due to the embryo trying to form its a home inside the uterus, something called implantation bleeding, in which case the pregnancy progresses without any complications. But at other times it could be worrisome. So, you must consult your doctor if you have either bleeding or pain or both in early pregnancy. And if it is severe pain or heavy bleeding, then you should go to the nearest emergency department of the hospital. Once in the hospital, confirm your pregnancy by a urine test. If that is indecisive, then we'll take a blood test called serum beta HCG. We shall be offering you an ultrasound, which could be done either using an abdominal probe or through the vagina. In India, girls are often very skeptical about the safety of the vaginal scan. I wish to emphasize that there is no evidence anywhere in the world that vaginal scan has any detrimental or harmful effect on your pregnancy. In fact, it does not require you to hold your urine, and it gives a much earlier idea of how the pregnancy is progressing and where it is located. We may do an internal examination, a speculum examination, or even take a swab for some infections. The common causes of bleeding or pain or both in early pregnancy, apart from what we have said, are firstly, threatened miscarriage, wherein girls are having bleeding from the uterus but the pregnancy is progressing well. We may request you to get a follow-up ultrasound done, but in most cases the pregnancy goes happily thereafter. The second condition could be that a girl has already had a miscarriage or is having a miscarriage. And in this case, girls are often very upset, but I must tell you that if 5 girls anywhere on the planet are pregnant, one will have a miscarriage. And in most such cases, the next pregnancy goes uneventfully. The third cause could be ectopic pregnancy or extrauterine pregnancy, wherein pregnancy is located outside the uterus, the commonest being the tube or the ovary. And since the tube cannot expand to accommodate a baby, it bursts, causing a lot of bleeding inside the tummy, and it could sometimes be life-threatening and may require hospitalization. The fourth, not so common condition is hydatidiform mole, wherein there are abnormalities of the placenta and pregnancy is not developing normally. Besides this, rarely polyps and few other conditions may cause bleeding in early pregnancy. At times, the pregnancy test is positive, but the ultrasound does not show any pregnancy, and we call it the PUL or pregnancy of unknown location. Girls are often intrigued, and why this can be? Firstly, if the pregnancy is too early, pregnancy test is positive, but the embryo is not seen on the ultrasound. Or if the ectopic pregnancy is there and it's too early to be seen on ultrasound. And thirdly, if a miscarriage has occurred and the uterus is got empty, then also your pregnancy test can remain to be positive for as long as 2 to 3 weeks. Now, it's very important to differentiate between these 3 conditions, for which we may request you to get serial serum beta HCG or the serial blood test done to see whether the level of the hormone is increasing, decreasing, or plateauing. Or we may ask you to get a serial ultrasound done to see where the pregnancy and how it is progressing. It may take us a week or 2 to reach a definitive diagnosis. Please bear with us till then. And in the waiting period, if you have severe pain in the tummy, heavy bleeding, or fainting, dizziness, or you have shoulder tip pain, then you must reach the nearest hospital emergency. I hope this video is helpful to you. If yes, please like, share, subscribe to your friendly channel Gynepedia, which is aimed to help you have a healthy health in future. Goodbye for now.